My name is Dr. Robert Martinez, and I'm a radiologist for the CitiMED group. A radiologist is a physician, an MD, medical doctor, that has gone through radiology training, residency, and medical school, and is instructed on how to interpret MRI studies, X-rays, CAT scan, ultrasound, all types of radiologic modalities. My training was at the University of Miami Medical School. Upon graduation, I started residency at the University of Miami, where I went through a 5-year radiology and nuclear medicine combined program. Upon completion of that residency program, I did an additional fellowship in musculoskeletal radiology for a total of 6 years of training. Board certification requires completion of an accredited radiology residency, and you have to take 3 exams, including a physics exam, a written radiology exam, and an oral board exam. The benefit is, particularly in this case, I have direct interaction with the referring physicians as interpreting the exams. If I have any critical findings or unexpected findings, I have direct communication with the physician, and these things can be addressed immediately. Injuries to the cervical spine, thoracic spine, lumbar spine, including disc herniations, bulging discs, fractures, to any type of extremity, the upper extremities, the arms, the legs, the knees, including fractures and soft tissue injuries such as meniscal tears in the knee, rotator cuff tears in the shoulder, any type of trauma-related injuries. The MRI exams are performed on a high-field MRI system, and the image quality is perfect. It's very, very good. My findings and interpretations of the exams are generally performed within a few hours to no greater than 24 hours. There are a few variations. A bulging disc is generally more generalized. It does not extend. The annulus is intact and does not come to a focal, somewhat of a pointed position. Disc herniation is more focal and generally extends beyond the annulus. Both can be associated with pain. Both mostly, what's important is what they are affecting. Impingement is impression or effect on. The thecal sac is the fibrous surrounding of the central canal with the CSF and the cervical cord, let's say. The thecal sac, at the front of it, impingement is basically a flattening or touching or altering the normal contour of the thecal sac. My performances as a radiologist for CitiMED include high-speed internet, which is the transmission of the images to the web-based browser that for the interpretation of the exam. It's high speed, almost immediate. So there's immediate access to the images for the interpretation, also improves the turnaround. There's also voice recognition capability, which also improves the turnaround time for the interpretation and the generation of the report. What I find to be most fulfilling in my position at CitiMED is the quality of care. There is timely transmission and acquisition of the images. There is timely interpretation and generation of the report, and there is also a very timely and open communication between myself and the referring physicians and nurse practitioners.